Next question. A 55-year-old man reports burning pain and numbness along the outer thigh that worsens with prolonged walking or standing. He has no back pain, leg weakness, or history of trauma. And neurological exam reveals intact strength and reflexes with decreased sensation over the lateral thigh. What is the most likely diagnosis? So you are having burning pain, that is dysesthesia. You're having numbness along the outer thigh. You are having no sort of motor weakness. So strength and reflexes are intact, but sensory is lost over here over the lateral thigh. Okay. So what is the diagnosis? Now, this is a very easy diagnosis. This is nothing but meralgia paresthetica. Meralgia paresthetica means there is entrapment of a nerve. What is this nerve? It is the lateral femoral cutaneous nerve. So that is the answer over here. When does this happen? So lateral femoral cutaneous nerve can be entrapped in many patients, like in patients who are obese with extra intra-abdominal compression, obese patients, pregnant patients, or if you're wearing tight clothing, or if you're wearing some sort of belts in that area chronically, or even in diabetic patients because of glycosylation, the entire nerve gets inflamed and you get something called as meralgia paresthetica. What happens is patients feel unpleasant sensation, that is like a burning or a pins and needles or a tingling sensation along the outer or the lateral part of the thigh. That is because your lateral femoral cutaneous nerve, when we say cutaneous nerve, it's a purely sensory nerve. It supplies that area. And there is no sort of motor involvement over there. So how do you treat this? You treat this with steroids, and you can even give nerve blocks over there, and it may help. So this is, and you have to treat the underlying cause. So that is your meralgia paresthetica and its treatment.